Sleep study, also known as polysomnography, is a test used to diagnose sleep disorders. It is a comprehensive sleep recording of biophysiological changes that occur during sleep. Polysomnography can help diagnose the following: sleep apnea, sleep-related seizure, periodic limb movement disorder, narcolepsy, insomnia, restless leg syndrome, bruxism, which is also known as teeth grinding, sleepwalking, and night terror. Sleep study is important to identify sleep disorders early because untreated sleep disorders can increase the risk of having heart disease, high blood pressure, stroke, and other medical conditions. The sleep study recording will take at least 6 to 8 hours. You are advised to bring all the medications that you are currently taking on the admission day. If you are on any heart, blood pressure, thyroid, or asthma medication, please take them as prescribed. Please inform the staff for documentation. Fasting is not required for this test. However, no food or drinks containing caffeine such as coffee, cola, tea, or chocolate should be consumed 6 hours prior to the test. Alcoholic drinks are also not allowed. Do not do strenuous exercises in the afternoon. Avoid taking short naps on the day of the test. You are advised to remove your nail polish. Do not bring jewelry and other valuable items. You will be admitted at night on the day of the test. Walk to the emergency block. Take the lift from lobby R to level 2. Upon arrival at the Medical Ambulatory Center, hand your admission form and NRIC or FIN to our staff. Please be patient while your admission is being processed. Our staff will then show you the way to your room. The sleep lab room is a single-bedded ward. You will be monitored by CCTV camera while sleeping. Visitors are strongly discouraged to stay overnight. Our nurse will assess your condition by taking your vital signs. Your temperature, blood pressure, medical history and allergy will then be recorded. You should have no fever, flu, or cough during the test. The nurse will orientate the patient on the room facilities. The respiratory lab technologies will attach sensors on different parts of your body. These sensors will remain in place while you sleep. This will be a painless process. The respiratory lab technologies will also hook up EOG, EMG, ECG, EEG, respiratory belts, position sensor, snoring sensor, pulse oximetry, airflow sensor, and leg sensor. You will be alone in the room. However, the respiratory lab technologists on duty will be in another room to monitor your progress overnight. They will gather data and do the necessary calibrations to ensure that the signals recorded in the polysomnogram are of good quality for a more accurate interpretation of your test results. The respiratory lab technologies will ensure patient safety and provide assistance if toilet visits are required. After 6 to 8 hours, when the test is completed, the respiratory lab technologies will start to unhook sensors between 6 a.m. to 6:30 a.m. Breakfast will be served from 7 a.m. onwards. You will be discharged by 7:30 a.m. Two days of hospitalization leave will be given upon request. These leave dates includes the admission day and the day of discharge. The results and the next step of your treatment will be discussed at the next appointment with your doctor.